and the neural circuits. So far, we have seen only neurons, right? Connection between two neurons at the synapse. Now, let's go away from this and beyond this and talk about neural circuits. But before that, I want to mention receptors first, and then after the receptors, I'm going to talk about the neural circuits, okay? So, let's have a focus on the receptors. I told you before that we have postsynaptic receptors on the cell membrane. They are proteins, right? But when we talk about receptors in a sensory system, we don't mean that receptors. We mean some cells, right? So, for example, in the retina of the eyes, we have two different types of cells called rods and cones, right? So they have nucleus, they have cytoplasm, membrane. They serve as receptors. What do they receive? Light. Okay? So, in the olfactory system, we have olfactory receptors. They are neurons. We have some dendrites in the olfactory epithelium. Okay? They are sensitive to some chemicals. So when you smell something, okay, the chemicals go into the nose, activate the tip of these nerves, and these cells are activated. Right? We have receptors on the tongue. They are sensitive to taste. Right? We have some receptors in the skin. For example, this one is called Pacinian corpuscle. This one is Meissner corpuscle. This one is Merkel's. Okay? We will see them in other sessions. So they are sensitive to mechanical deformation of the skin. So when you press the skin, this mechanical displacement activates these neurons. So receptors are activated so they can detect touch, pressure, vibration, and everything. Okay? We have also other receptors in the skin that are very sensitive to any change in the temperature. Some of them are cold receptors, others are warmth receptors. Right? Other receptors are sensitive to pain, so any damage to the tissue may activate them. We call them nociceptors. We will see them, okay? There are also receptors in the internal ear. We call them hair receptors or hair cells. Okay? There are two types of these hair receptors. Some of them are sensitive to sound, so they can hear by them. Some others are sensitive to change of the balance. So when you bend forward or bend backward or to the right or to the left, these receptors are activated so they can detect any change in your balance or equilibrium. Right? Other receptors are present in the muscle. So any change in the length of the muscle activates them. We call them muscle spindles. So, our sensory system is not limited only to 5 different sensations: vision, hearing, smell, taste, touch. We have also receptors for the length of the muscle. We have receptors for change of balance. Right? We have also other receptors. Let's see them. A long list of receptors are present in your body. Some of them are called mechanoreceptors. So they are sensitive to mechanical changes. Any type of mechanical change, okay? So in this category, we have skin receptors. So when you press anything, when you touch an object, you are pressing your skin actually. Right? So these receptors are activated. So you can see the name of the receptor. And in the ear, we have hair receptors that are sensitive to the sound. Sound is a mechanical energy. Right? So hair receptors in the internal ear are mechanoreceptors. right? And let's see baroreceptors. You know them. In the aorta and carotid, right? So they are sensitive to pressure, arterial blood pressure. Pressure is a mechanical energy. So baroreceptors are mechanoreceptors, right? So you can see that we have some receptors that respond to changes of the blood pressure, but you're not aware of that. Okay? So sensory systems are not limited to 5 standard sensations. We have more of them. Some of them reach consciousness, and we are aware. But most of them do not reach consciousness, but they are working at a subconscious level. Okay? Right? We have thermoreceptors, cold and warm. We have nociceptors, which are sensitive to tissue damage. We call them pain receptors. There are a lot of them. We have chemoreceptors. So taste receptors are sensitive to chemicals. So there are chemoreceptors. Smell receptors or olfactory receptors are sensitive to chemicals in the air. Right? So when you smell perfume, you are bringing the molecules into your nose, and they are activating some receptors in your nose, and you can feel them. So they are chemoreceptors. And for example, we have some receptors for osmolality of the fluids. So changes in the osmolality activate these cells. Or changes in the blood CO2 activate other cells. So we have a long list of receptors in our body. Right? They can be classified into mechanical, thermal, nociceptors, chemoreceptors, and we have another category, electromagnetic, sensitive to light. So 5 different categories of receptors. Remember them, okay? Memorize them. In the skin, we have several types. For example, we have 3 nerve endings. Axons that are branched several times like a tree. We call them free nerve ending because at the tip of these nerve endings there is no special structure. But other receptors have some special structures at the tip. For example, this one is a nerve tip which is surrounded by several layers of capsules. We call this Pacinian corpuscle. This one is a nerve tip which is surrounded by one capsule. We call this myasthenic corpuscle. This one is Coombs corpuscle. Any ending. Golgi tendon apparatus. I'm going to talk about this in other sessions, okay? Now I only mention the names. Muscle stimulants. So several types of receptors are present in the skin, muscles, and joints. We call them somatic sensation, somatic receptors. So senses can be generally classified into special senses and somatic senses. Special senses are those that we have some special organs for them, like we have eyes for vision, ears for hearing, tongue for taste, nose for smell, right? But for somatic sensation, we don't have a special organ. Receptors are all over the skin, all over the joints, all over the bones, all over the muscles. So these type of sensations are called somatic, but those are special, right? These are receptors involved in somatic sensation. For any receptors, we have some principles. Okay? The first principle is differential sensitivity. What does it say? It says any receptor is only sensitive to one type of energy. Okay? So a rod in the retina is only sensitive to light. You cannot activate the retina by pressure. Okay? So it only responds to light. Hair receptors in the ears are only sensitive to sound. There is no other way for activation of them. right? So any receptor has only one special stimulation. We call this differential sensitivity. Another important term is modality of sensation. Any receptor is only involved in one sensation. And we have different modalities of sensation. So we have modality of vision, modality of hearing, modality of touch, modality of pressure, modality of pain, modality of taste. Okay? So the second principle, the third principle is labeled line principle. Labeled line. So all of these receptors have some axons, right? Because they are neurons actually. So they should send the action potential to the CNS. So a receptor which is in your fingertip, right? When activated, should send the action potential to the spinal cord. In order to send the action potential, it needs some fibers, right? So any receptor is connected to the CNS by way of some fibers. All of these fibers use action potential. So a receptor for pain sends action potential to the brain. A receptor for touch also sends action potential. A receptor for pressure sends action potential. A receptor for light sends action potential. So all neurons use action potential. And action potential is only change of potential. So an action potential in one nerve may mean pain. Another action potential in another nerve may mean touch. Right? So that's why we say that each fiber has a labeled line, or is a labeled line. So this fiber is labeled for pain, another fiber is labeled for touch, another one is labeled for vision, another one is labeled for, I don't know, blood pressure, for sound, for everything. So we call this labeled line principle. So specificity of nerve fibers for transmitting only one modality of sensation is called labeled line.
Sir, while cooking, sir, when we started to cutting onion, sir, we started tearing. Tear comes out of our eye. Why this happens, sir?
Why tears come out of the eyes? When what?
When we are chopping onions, sir.
So the onions is actually emit some chemicals in the air. They activate some chemoreceptors. Okay? Or they may directly activate the cells. Yeah. So this way they cause curing. Usually we have some nuclei in the brain stem, okay, that are sensitive to some chemicals, like from the onion, okay? So they cause a reflex, but this reflex is not in the spinal cord, it's in the brain stem. By this reflex, they cause secretion of the tears, okay? You will see this, maybe. Okay. So far we have seen that we have several types of receptors with different sensitivities to different stimulations. All of them use nerve fibers. And in each nerve fiber we have action potential. So action potential is a common language of all cells. So when neurons talk together, they use action potential. So it's a common language of CNS, right? All neurons in the CNS. Now, the main action of each receptor is conversion of one type of energy to electrical signal or electrical energy. So when you press the key, receptors in this key receive the mechanical energy, generate electrical energy. Okay? Action potential is an electrical energy. When you see something, the light hits the retina, electromagnetic energy is converted to electrical energy. So this is the main function of all receptors, right?
Transaction.
All kinds of stimuli change the membrane electrical potential of the receptor. Membrane electrical potential of the receptor. We call this receptor potential. So this is the, I think, fifth type of potential that you ever heard, right? Action potential, resting membrane potential, synaptic potential, receptor potential. Yeah, postsynaptic potential I mentioned, okay? So, you have also receptor potential that occurs in a receptor after the stimulation. So all receptors receive different types of energies, generate receptor potential, but this receptor potential cannot go through the nerve to the CNS, like synaptic potential. It should activate action potential. So we have a stimulation, then we will have receptor potential, then we will have action potential, right? So mechanisms for generation of action potential or for receptor potential is different in different receptors. For example, for touch receptors, okay, in the cell membrane, we have some type of channels that are sensitive to mechanical energy. So maybe that this one is a receptor, like Pacinian receptor. This one is a nerve tip. Okay? So this one is the nerve tip. Okay. You press the skin, so you apply pressure. Okay? Pressure causes a change in the mechanical form of or the structure of the receptor. So it causes opening of some channels in the membrane of this receptor. The channels are opened due to mechanical change. Okay? So we have seen some channels that are sensitive to voltage. Right? You know them. Sodium channels, potassium channels that are involved in action potential. All of them are voltage sensitive. They are open if there is a change in voltage. We have other channels sensitive to ligands. When a neurotransmitter is released, it binds to the receptor, opens some channels. So channels can be opened by voltage, by a ligand, by mechanical stress, mechanical pressure, or mechanical deformation. Okay? So these channels are mechanosensitive. So after that sodium goes into the cell, we will have change of potential, which is called receptor potential. Right? So receptor potential in the Pacinian corpuscle is the result of opening of some channels which are mechanosensitive. Right? But in the eyes, we don't have mechanical receptors. We have some rods like this. Okay? We have some chemicals inside the cell. When light strikes the membrane, activate these chemicals, then these chemicals may affect some channels. So they can open the channels or they can close the channels. In the rods, they close. So during the darkness, we have inward movement of sodium. So sodium keeps going into the cell in darkness. Okay? When the light strikes the retina, we have some biochemical processes in the cell that finally close the sodium channels. So sodium cannot go into the cell. Okay? So we will have hyperpolarization of the cell in response to the light. So you can see that the mechanism in a rod is different from the mechanism of receptor potential for example, in the pacinian corpuscle. So every receptor cell has its own way of generation of action of receptor potential. Receptor potential then is converted to action potential. So now let's consider the pacinian corpuscle as an example. Okay? So here you can see the pacinian corpuscle or pacinian receptor. So it's the nerve tip, right? This is a capsule which surrounds the nerve tip. Actually, we have several layers of this capsule, but only one of them is shown here. Okay? So inside the capsule is full of a fluid. You cannot see? Change the pointer, okay? So the nerve tip, the capsule, there should be a lot of layers of the capsule here, but only one is shown here. So, and you can see the myelin here. Okay, so the nerve tip is not myelinated, but the rest of the fiber is myelinated. Right? So there are some channels here that are sensitive to mechanical energy. Pressure applied on this capsule causes opening of these channels. Sodium goes into the cell. We will have positivity inside the cell, which is called receptor potential. The receptor potential itself cannot go through the fiber to the CNS. It should activate action potential in the nerve. Action potential cannot be generated here because we don't have voltage sensitive sodium channels here. They are here at the nodes of Ranvier. You know the nodes of Ranvier?
Yes.
Very good. So we have a lot of channels here and here and here. So receptor potential causes change of potential at this point. Sodium channels are open. Sodium goes into the cell. We will have action potential. The action potential jumps from this node to this node. And from this node to this node. What do we call this? Saltatory conduction. Good. So pressure opens sodium channels, which are mechanosensitive. Sodium goes into the cell. We will have receptor potential. Receptor potential means a change of potential. It opens voltage sensitive sodium channels. They are open. We will have depolarization, repolarization, so action potential. This action potential jumps to the next nodes of Ranvier, from that node to the other one, and so on. This is called saltatory conduction. Very good. So, here we have the stimulus strength. I mean the strength of the pressure we applied. Right? And here we have the amplitude of the receptor potential. So, if you press the pacinian corpuscle weakly, a small receptor potential is generated. Right? So with weak stimulation, we will have a little change of potential. With a strong stimulation, we will have a large receptor potential. Right? So, the more the pressure, the higher the voltage. Does it make sense?
Yes.
Good. But the relation is not linear. It's like this. Okay? So we have more sensitivity here, less sensitivity here. Okay, keep it in your mind. So, pressing the pacinian corpuscle generates receptor potential. The size of the receptor potential depends on the strength of the pressure.
Yes.
Right? Now, this cell wants to generate action potential at this point. Receptor potential goes toward the first node of Ranvier, right? So in the first node of Ranvier, when the receptor potential exceeds the threshold, we will have action potential. As long as the receptor potential is higher than the threshold, we will have action potential. So the frequency of action potential is determined by the size of the receptor and the duration of the receptor potential. the duration and the size of the receptor depends on the
Stimulus.
So with more stimulation or with stronger stimulation, we will have larger receptor potential. Larger receptor potential generates higher frequency of action potential. If you get this, for sure, you will have maybe 2 or 3 scores in your final exam. Okay?
Explain again.
No. Okay. So I may ask you, okay? For example, I may ask something like this. So where is it? Okay, which one increases? Why? Increase in the intensity of pressure in a Pacinian corpuscle. So in a Pacinian corpuscle, which one increases by increasing the intensity of pressure?
Amplitude, sir.
Frequency, amplitude,
Amplitude.
Frequency of
Frequency.
amplitude, sir.
All of you agree with this?
Amplitude, sir.
Amplitude, sir.
All got it right. Okay, so by increasing the pressure on the Pacinian corpuscle, threshold doesn't increase because it's constant. Okay, so this is the threshold.
Amplitude, sir.
The size of the action potential doesn't increase. The size of action potential is constant. Right? So amplitude is constant. Duration or the width of the action potential doesn't increase because it's defined by the opening of sodium and potassium channels. So it's the same. The only thing that increases is frequency.
So but you said here that when we have more pressure,
Yes. Amplitude is
Yeah, but this is for receptor potential. But here we have action. You made a good point. I may change this. Okay? I may change action potential to receptor potential. So for some of the options, it's possible, okay? So, the amplitude of the receptor potential increases, but the amplitude of action potential doesn't increase. Right? The frequency of action potential increases, but the frequency of the receptor potential doesn't increase. Okay? So,
Sir, if we increase the
so
strength,
I think that the questions are easy for you because you all got it right, you know. So I can increase the level of the difficulty. Kidding,
if
actually.
we increase the strength of the pressure in the
Yeah.
within the threshold,
But the threshold doesn't increase. It doesn't increase. So it's a standard for the cell. The cell says that any time that the potential reaches minus, for example, 55 or minus 55, I will generate action potential. So this is all the same for any cell. Okay? So threshold doesn't mean
So first there is minus 90, then minus 70, then minus 50.
no. Action potential starts from the threshold. Okay? It starts from the threshold. So it's the same. So the person that for the first time discovered this got a Nobel Prize. No? Actually, the scientist that showed that the amplitude doesn't increase, but the frequency increases. He won a Nobel Prize, actually. Okay, so a lot of these won Nobel Prize in the past because they are very important for our understanding of our body. And all of the drugs, all of the treatment that we have. Okay, so a lot of patients every day come to the hospital and they are treated. How they are treated? By knowing these.
Sir, it means,
Okay?
sir, it means if we increase the action potential, the membrane potential higher than the threshold, it is.
It causes action
It is
potential.
useless, sir.
No.
It just depends upon the frequency.
Yeah. Action potential is generated.
Sir, if
So, but all of them have the same size.
Same size, same amplitude.
But,
if we increase the action potential higher than the threshold,
so you mean resting membrane potential higher than threshold.
yes, sir.
Okay?
The,
Then we will have action potential.
yes, sir. If we increase the 50 times higher than the,
Okay. If we increase it more than this,
yes, sir, then the effect is
again we
same.
will have action potentials, but with the same size.
Same size.
Yes, sir. The effect will be same.
But the frequency of action potential here and the frequency here are different.
Different.
Frequency will increase.
So, for example, imagine that this one, this sound, is an action potential, right? So a fiber is sending action potential to the brain. The brain hears this. Okay? In another situation, the brain hears this. So it's a signal for brain. Okay? The brain can make difference between these two. Okay? We will have this. No, this is not adaptation. It's something else. Okay. So, shall we go on? Yes. Thank you so much for being so enthusiastic for neuroscience. Okay. So, let's get back to the receptor. I mean the pacinial corpuscle. I told you that if you press the skin, stimulation, right? The answer is change of potential, right? So, when there is no stimulation, there is no receptor potential. When you press, but weakly, like this. So you start the press, you continue the pressure, you end it, you release, right? What's the answer? It's a receptor potential. Does it reach to the threshold in this case?
No.
No, we don't have action potential. Another example. You press the pacinial corpuscle for a shorter time, but stronger.
Strong test.
You will have receptor potential which goes beyond the threshold. You will have action potential. Only one. Now, we have the same strength of the pressure, but for more time. Receptor potential is generated, and as long as you have the pressure, the receptor potential continues. So you will have a frequency of action potential, or a train of action potential. So with another stimulation, the duration is the same, but the strength is different. Here we have more pressure. The result is more action potential. So frequency here is more than frequency here. Right? 1, 2, 3, 4, 5, 6, 7 action potential per second. 1, 2, 3, 4, 5, 6, 7, 8, 9 action potential per second.
Sir,
So, the frequency of firing of sensory neuron depends on the intensity of the stimulation and duration of the stimulation. two factors that determine the frequency of the firing. Firing means generation of action potential, right? Or let's say depends on intensity and duration of stimulation.
Sir, all the potentials in section D, the receptor potential, have the same amplitude or different amplitude?
Amplitude of the receptor potential?
Yeah, all the potential in section D.
Yeah.
Only receptor potential, not about the action potential.
So we have action potential here. So receptor potential is this one. Okay? It goes here, and from here we have action potential.
I'm asking about the amplitude of receptor potential here.
So, you know, action potential and the receptor potential has the same quality. Both of them are potential, right? So the receptor potential is mixed with action potential. So when you put the electrode, you can only record the potential. So you cannot see two different potentials here. So they are combined together. So you can see only one. But after having the repolarization, receptor potential again shows itself. Right? You will have the second action potential. And so on. Yeah? So we won't have action potential. So with increasing the duration, okay, with increasing the duration but at a lower intensity, we won't have action potential. Why? Because, for example,
it cannot reach the threshold.
if you what?
If the receptor potential will not reach the threshold, we cannot reach.
You're saying, okay. So, this is the threshold. You applied a long duration of stimulation, but it's low in amplitude. Right? So, this may generate a receptor potential, which continues, but it lost over time. Because receptor potential is made by opening of channels, right? When sodium channels are opened, but they fail to generate action potential after that potassium channels are opened. So potassium goes out of the cell and oppose generation of more receptor potential. So receptors goes high, then it come back again. Because potassium channels oppose sodium channels, right? You have this in the cell physiology. Remember that?
So what is different between receptor potential and electronic condition? Because I think both are in
Yeah, it's the same actually.
But they both are same.
Yeah, so both of them are electronically conveyed.
Like because receptors are in the red cell. So before action potential we don't have electronic condition.
Yeah. Actually, you're talking about this. So this one, right? Receptor potential goes through the cytoplasm. So it's like electrophonic conduction in the endpoints. Yeah, so the nature of them are both the same. Yeah, but usually I don't use this in the exam, okay? Because you may be confused. But if you ask, I should explain, okay? So the receptor potential is also conveyed through the cytoplasm. So it's a type of electrophonic conduction. But here we don't have decrement. Because axons are not that leaky that they right up. Okay? So let me go on.
For action potential, amplitude are always same. Amplitude are always same. It means that amplitude just depends upon the type of neuron.
Yeah,
Type of neuron.
the type of new neuron.
Different types of neurons with different amplitude.
So the size of the action potential and the duration of the action potential and also the shape of action potential is defined by the type of the neuron. For example, you have in a cardiac muscle, you have this type of action potential. Right? Sodium Calcium, right? Am I right?
Yes.
Potassium. Right? So this is the property of the cardiac muscle because it has sodium channels, calcium channels, potassium channels. Neurons doesn't have calcium channels like this. Okay? So you can imagine a neuron that has a lot of sodium channels. So when it's activated, it goes straight forward upward, like this. So you will have a sharp depolarization. But in another neuron, maybe you have less sodium channels, or there may be several potassium sodium channels, but the kinetic of this channel is different genetically. So you will have, for example, a lower skip of the action potential. So it's not that sharp like this. Okay, so this is property of the neuron. So amplitude of action potential, duration, and the sharpness, and the shape, all depends on the type of the neuron. Okay, you have seen the type of the neurons in our previous session. I told you that we have bipolar cells, I don't know, some neurons with huge dendrites, some other neurons with huge axons, okay? So we have different types of cells, all of them have different types of action potential. And I also record the action potentials in my lab. We will see the differences in the shape, okay? Differences in the amplitude and also everything in the structure of the action potential. So did you have your lunch now in the canteen?